Hi, my name is Josh Nichols. The title of my internship project is Soft Tissue Scraping with the Graston Technique. I did my internship at North Star Physical Therapy. It's a small privately owned clinic in Star, Idaho. My internship supervisor is Brian Nichols, and he's also the owner of the clinic there. Basic description of my project: basically, anytime I was there and PT was planning on scraping one of their patients, they would let me know, and I would either drop what I was doing or finish it up and go observe, watch them scrape, try to learn what I could, ask questions when I had them, and just figure out things on my own based on what they were doing as well. Once I felt a little more comfortable after a couple weeks, I and felt like I could maybe begin to do it on my own a little bit, I would practice scraping on my supervisor when he had time, if he had a cancellation or something, and that continued for a few weeks. All in all, I spent about 5 weeks on my project. The purpose of my project: I want to go to PT school, so scraping is just one of many manual therapies I'll have to learn eventually, and it's one I'm pretty interested in because I've had it done before, and I feel like it works pretty well. So I wanted to try to understand it a little bit more. Few of the big things I learned: there's a lot more styles of scraping that come with the Graston technique specifically than I thought. A few of the major ones that were used a lot that I observed was the swivel technique, where you put it on a hot spot and turn while putting pressure. Brushing, which is basically just like small strokes on one specific spot. And then the most common one, of course, just normal scraping, where you're going along the whole muscle belly, whatever muscle is hurting. The swivel technique is really good for breaking down scar tissue. They all obviously have their unique purposes, and they all accomplish other things, but they have primary goals as well. So yeah, the swivel technique is really good for breaking down scar tissue. The brushing technique causes quite a bit of inflammation in that area in a good way. It increases blood flow and helps promote healing. And then the basic scraping technique, that's the most commonly used, kind of does all of it. It helps reduce swelling, it increases blood flow, it breaks down adhesions in the tissue, and has a lot of really good benefits. So looking at the tools, they all kind of have their own uses, of course. That's why there's multiple. Graston Tool 1, which is the long one on my poster. It's mainly used for large areas like hamstrings, quads, the IT band sometimes, and sometimes like the side of your body if it needs it. Graston Tool 2, the one with the larger grooves, it's not used quite as often, but it can be used for calves, biceps, sometimes the upper trap. It fits really nicely around those tissue areas and can just hit the whole area of the tissues rather than just one part of it at a time with some of the more all-purpose tools. Speaking of which, Graston Tools 3, 4, and 5 are the more all-purpose ones. 3 is the rectangular one. It is made for smaller areas, because with that one you use the ends of the tool, whereas with the other two you use the sides of the tool. 4, which is the one that's curved on one side and flat on the other side, is my supervisor's favorite. He uses it most. He feels like it is the most effective for him when he does scraping, and he can use it in a lot of different areas. And then 5 is the one that's rounded on both sides. He uses that one a decent amount too, but just not quite as much as 4. And they, for the most part, serve relatively similar purposes. And then 6, it's similar to 2 in the way it's used. It's the one with the smaller grooves and the knob on one end. It can be used for like the Achilles and the wrist. It fits nicely around there and can be used to scrape that out. And then the knob on the end, this is something interesting that I found. He really likes to use the knob on the end of that one to scrape out the sternocleidomastoid, which is interesting to me because, I mean, if I had to decide which scraping tool to use, I would probably just go with 4 because it's the most general purpose one, and sternocleidomastoid doesn't seem like it would have a super niche strategy that could be used, but it does, because he's found that knob to be really effective for scraping out the sternocleidomastoid when it needs it. In terms of application of information I've learned in classes, Kines 427 and 270, which are athletic therapy and applied anatomy, respectively, are probably the classes I used the most. Learning about like the function and mobility and how to improve them, as well as like common injuries such as strains and how they affect soft tissue in 427 is definitely the thing I applied the most. I'm taking that class right now, so like sitting in class and hearing certain information and being like, oh, what tool would I use here, or how could I apply that to what I'm learning with my project was super interesting. And then in 270, applied anatomy, just learning like the range of motions specifically and being able to use those to identify when scraping is needed based on like, oh, this tissue's tight or this tissue's damaged or they have scar tissue here, based on like range of motion and what the injury was super useful too. Overall, I feel like I learned a lot more than I expected going into this project. Uh, my biggest takeaway is there's a lot more applications for scraping than I initially thought. Um, there was, I mean, obviously, there's a number of different techniques. I only mentioned a few of them. There's a lot more that we briefly covered during my project, but not as much as the ones I mentioned. And yeah, it's definitely something that can be applied to a wide range of injuries. And yeah, so that's a summary of my project. Thank you for watching.